Medtronic Physio Control is pleased to present the in-service video on the Lifepak 12 defibrillator monitor series. This video will give you an overview of the operation and basic features of the Lifepak 12 defibrillator monitor. For complete details on its operation, refer to the operating instruction manual. This in-service video is divided into several sections. First, basic orientation reviews the power supply, therapy accessory options, the printer, controls and indicators, and setup options. Next, this video reviews the operation of the Lifepak 12 defibrillator monitor for ECG monitoring and pulse oximetry, automated external defibrillation, manual defibrillation, synchronized cardioversion, non-invasive pacing, therapy warnings, acquiring a 12-lead ECG, non-invasive blood pressure, end-tidal CO2 monitoring, invasive pressure monitoring, and data management. Your Lifepak 12 defibrillator monitor may not have all of these features. It is important that you are thoroughly familiar with the configuration of your particular device. For ease in locating the video sections that apply to your device, each section has an identifying title bar. The Lifepak 12 defibrillator monitor is powered by 2 batteries, or the Physio Control AC and DC power adapters. 4 types of batteries may be used. Fastpack batteries are a nickel-cadmium chemistry and do not communicate to the monitor about battery charge level. Lifepak batteries can communicate battery charge level to the monitor. Charge status for Fastpack batteries 1 and 2 is indicated by battery symbols on the screen. Because the Lifepak batteries communicate with the monitor, the battery symbol shows the level of charge. A low battery is indicated by this symbol. A battery low message with a tone indicates when one battery is low. The replace battery message along with a tone or voice prompt indicates both batteries are low. Replace one or both batteries immediately to prevent shutdown of the defibrillator. The batteries require proper maintenance to optimize their performance. To charge and condition these batteries, use the Battery Support System 2. The AC and DC power adapters provide operating power to the Lifepak 12 defibrillator monitor and charge the installed batteries. The AC power adapter is shown here. The power adapters charge one battery at a time. Once the batteries are fully charged, they are trickle charged to maintain the charge level. The power adapter connects to the defibrillator with the output cable. When connected, check that the power LED lights indicating the adapter is on. Check that the battery charge LED lights indicating the batteries in the defibrillator are charging. Disconnect the power adapters before each use, or permanently mount the power adapter and carry it to each use. Refer to the power adapter operating instructions for more detailed instructions. The Lifepak 12 defibrillator monitor uses quick combo pacing defibrillation ECG electrodes, standard adult defibrillation paddles, fast patch disposable defibrillation ECG electrodes, pediatric and posterior paddles. Internal and external sterilizable paddles are also available options. Only the quick combo therapy cable and electrodes will be demonstrated in this video. Refer to the Lifepak 12 defibrillator monitor operating instruction manual for more information about these and the other therapy accessories. The Lifepak 12 defibrillator monitor may be configured with either a 50mm or 100mm printer. The 100mm printer is shown here. To change the paper, lift the printer door latch and pull out the door. Remove the empty paper spool. Insert the new paper roll with the graph side facing up and paper extending out of the printer. Close the printer door and push down on the latch until the door clicks shut. Press Print to check that the paper advances. The message "Check Printer" appears if you turn on the defibrillator and the printer door is open, no paper is in the printer, or some other problem is present. Control buttons are activated by pressing the center of the button or by pressing the up or down arrow on the side of the button if present. Lighted LEDs indicate a function is active. When the defibrillator is powered on, all the LEDs light as part of the self-test. Controls are grouped by function. In this area are the on-off, AED, and manual defibrillation controls. The battery charge and service indicators are also seen. ECG lead and size and NIBP controls are here. The pacing controls are grouped in this area. The print, 12 lead, and transmit controls are located here. User controls are grouped here. User controls include the selector, contrast, home screen, event, options, and alarms. The selector is used to scroll through and select areas on the screen and menu items. When active, the selector LED lights. While it's active, press the selector to select items that are highlighted. To adjust screen contrast, press the contrast button. Turn the selector to change the contrast setting. When the defibrillator is powered off and then on again for the next use, the contrast level remains at the prior setting until readjusted. The home screen is the background screen that is displayed during monitoring. Press Home Screen to return to this screen from any menu. The Event button allows you to annotate events on the Code Summary Event log. Press Event to access the event menu. Rotate the selector to highlight the desired event. Note that the highlight is gray. Press the selector. This selects the event, which becomes black highlighted, and appears with a timestamp in the lower area of the screen. For information about defining events for your Lifepak 12 defibrillator monitor, refer to Defining Setup Options in the Operating Instruction Manual. The Options button allows you to enter the patient's name, change pacing mode to demand or non-demand, change the date and time, adjust the alarm and voice prompt volume, activate an automatic self-test, change printer mode to monitor or diagnostic frequency response, print or delete reports from previous patients. For more detailed information about the options features, consult the operating instructions. The Lifepak 12 defibrillator monitor features quick-set alarms. Quick-set alarms can be configured to be on or off when the defibrillator is powered on. If quick-set alarms are configured off, push Alarms to activate the alarm. The Alarms menu appears. When activated, Quick-set automatically sets alarm limits around the patient's current vital sign values for all monitored parameters. If the limit setting is acceptable, press the selector. Quick-set highlights in black and a bell symbol next to the monitor parameter indicate alarms are active. When an alarm limit is exceeded, a continuous tone sounds, the affected parameter and alarms button flash, and a message appears. To manage the alarm, first press Alarms. This silences the alarm for 2 minutes. The message Alarms Silenced appears. To silence the alarm for longer than 2 minutes, select Silence on the menu and the desired length of time. Next, assess the cause of the alarm and whether narrow limits, if selected, should be set to wide. If the patient is unstable, do not reselect Quick-set. Reselecting Quick-set resets the limits around the patient's changed vital sign values. This may be outside the safe range for the patient. Only after the patient is stabilized should you reselect Quick-set if necessary. In addition to the Quick-set feature, the VFVT alarm continuously monitors for ventricular fibrillation and ventricular tachycardia. When selected on, the alarm symbol appears above the primary ECG. When the VFVT alarm is silenced, an X appears over the symbol. Select Off to turn off this alarm. The Lifepak 12 defibrillator monitor provides maximum flexibility in operating features through its setup options. The setup options define power-on defaults for all operating functions. Once configured, setup options can be transferred from one Lifepak 12 defibrillator monitor to another. In this video, the defibrillator is set up with the factory defaults. It is important that you are familiar with and understand the power-on defaults on your defibrillator. Refer to the Lifepak 12 defibrillator monitor operating instructions for details on defining these setup options. This concludes the basic orientation section of this video. The following sections address therapy procedures. Periodic inspection and testing of the Lifepak 12 defibrillator monitor helps to ensure that the defibrillator is ready for use at all times. An operator's checklist is provided in the operating instruction manual. It is a suggested checklist to inspect and test the defibrillator. It may be photocopied for your use. This checklist is not a replacement for preventive maintenance tests, which should be performed regularly by qualified service personnel. The patient's ECG can be monitored with a 3-lead, 12-lead, or 5-wire cable. This is referred to as ECG leads monitoring. The ECG can also be monitored with standard or hard paddles, or the quick combo therapy cable and electrodes. This is referred to as paddles lead monitoring. The Lifepak 12 defibrillator monitor screen can display up to 3 waveforms. The top waveform area is called Channel 1, the middle area is Channel 2, and the lower area is Channel 3. The ECG always displays in the top channel when the defibrillator is on. Channel 2 may be left blank or display a continuation of the Channel 1 ECG or one of the other monitoring parameters or a trend graph. Channel 3 is available only if a 100mm printer is installed. It may be left blank or display a different waveform or a trend graph. Consult the operating instructions for more information about using channels 2 and 3. When the 3-lead cable is connected, only 3 limb leads, 1, 2, and 3, can be selected for ECG monitoring. When the 5-wire cable is connected, the 6 standard limb leads can be selected for ECG monitoring. In addition, the 5th wire can be placed in any of the chest lead positions. When the 12-lead cable is used, the standard limb and precordial leads are available. Only the 12-lead ECG cable will be demonstrated in this video. The 12-lead cable has 3 parts: the main cable that plugs into the monitor, the limb lead attachment that plugs into the main cable, and the precordial lead attachment that also connects to the main cable. The precordial lead attachment is not required for basic ECG monitoring. It is used for precordial lead monitoring or to obtain a 12-lead ECG, which is covered later in this video. To monitor the patient's ECG, press on. Adjust screen contrast if necessary. Connect the ECG cable to the monitor if not already connected. For the best signal quality, prep the ECG electrode sites by cleaning the skin with an alcohol pad, followed by a brisk rub. Shave the electrode sites if necessary. Confirm that the electrode's expiration date is not passed, and attach an electrode to each of the lead wires. Remove the electrode from the carrier and check that the gel is intact. Holding the electrode taut with both hands, apply the electrode flat to the skin. Avoid pressing the center of the electrode. Place the white right arm electrode on the patient's upper right chest below the clavicle. Place the black left arm electrode on the upper left chest below the clavicle. Place the green right leg electrode on the lower right chest, and place the red left leg electrode on the lower left chest. Secure the cable with the clasp to prevent tension on the electrodes. Check that the ECG is displayed on the screen. If the power on default is lead 2, the patient's ECG and the indicator 2 are displayed. If the power on default for the ECG is paddles lead, the screen displays a dashed line and the lead indicated is paddles. To change to lead 2 or any other lead, press the lead button. The ECG lead menu appears and the lead automatically changes to lead 2. If another lead is desired, continue to press the lead button or rotate the selector. After a few seconds, the menu disappears, or you can press the home screen button. Alternatively, you can use the selector to highlight channel 1 and change the lead. Check that the ECG size is adequate for heart rate counting. If the ECG size is too small or too big, heart rate counting may be inaccurate. The heart symbol should flash, and the systole tone should sound once with each QRS. To adjust the systole tone volume, highlight the heart rate area, press the selector to display the heart rate menu, press the selector to black highlight QRS volume, then rotate the selector to increase or decrease the systole tone volume. If the heart rate counting is inaccurate, adjust the ECG size. Press the size button. The size menu appears. Continue to press the size button or rotate the selector to change the size. Note that the ECG trace in channel 1 automatically changes as each size is selected. To monitor the ECG in paddles lead with the quick combo therapy cable, press on, adjust screen contrast if necessary, connect the therapy cable to the monitor if not already connected. Wipe clean and dry the patient's skin, shave or clip excessive hair, and avoid placing electrodes over broken skin. Do not use alcohol, tincture of benzoin, or antiperspirant to prep the skin. Check that the therapy electrode's expiration date is not passed. To prevent drying out of the electrodes, open the package and remove the backing only immediately prior to use. After removing the backing from the electrode, apply the electrodes on the patient's chest in the anterior lateral position. The electrode with heart symbol is placed lateral to the patient's left nipple in the mid-axillary line. The other electrode is placed to the right of the sternum below the clavicle. Press the electrodes firmly from one end to another to prevent entrapment of air. Connect the electrodes to the therapy cable. Check that the ECG is displayed on the screen. If the power on default for the ECG is lead 2, select paddles lead. As previously described, check the ECG size and that heart rate counting is correct. The most common problem encountered with ECG monitoring is poor ECG signal quality. High frequency or 60-cycle interference may be caused by equipment connected to the patient that is improperly grounded. This may be temporarily corrected by operating the other equipment on battery power or unplugging unnecessary equipment. Baseline wander may be due to the patient's breathing. This may be corrected by repositioning the ECG electrodes to an area with less movement. Two other reasons for poor ECG quality are using outdated electrodes and inadequate skin prep. Always use fresh electrodes and prep the skin as previously described. The frequency response of the monitor screen is intended only for basic ECG rhythm identification. It does not provide the resolution required for diagnostic or ST segment interpretation. For diagnostic, ST interpretation, or to enhance internal pacemaker pulses, Attach the ECG cable and print the ECG in diagnostic mode or obtain a 12-lead ECG. This concludes the ECG monitoring section of this video. The automated external defibrillator is to be used only on patients in cardiopulmonary arrest. A patient must be unconscious, not breathing spontaneously, and pulseless before the Lifepak 12 defibrillator monitor is used to analyze the patient's ECG rhythm. Advisory mode should be used only on adults and children greater than 8 years old. After confirming cardiac arrest has occurred, press on. If necessary, prep the patient's skin for electrode placement. The Connect Electrodes message and voice prompt occur until the patient is connected to the defibrillator. Apply the electrodes in the anterior lateral position. Continue CPR throughout this procedure if possible. Stop CPR and press Analyze. The defibrillator prompts,
Analyzing now. Stand clear.
Do not move the patient or therapy cable during analysis. If a shockable rhythm is detected, the defibrillator prompts,
Shock advised.
and the charge tone sounds as the defibrillator charges to 200 joules.
Stand clear. Push to shock.
Tell everyone to stand clear from the patient.
Move patient.
Check that no one is touching the patient, then push the shock button to discharge the energy to the patient. If auto-analyze is on, the defibrillator automatically analyzes the rhythm after the shock. If the auto-analyze feature is off, you are prompted to push Analyze.
Analyzing now.
If a non-shockable rhythm is detected, the defibrillator prompts,
No shock advised.
check for the presence of a carotid pulse. If there is no pulse, begin CPR. The defibrillator enters CPR time. The duration of CPR time can be adjusted to meet the needs of your local protocol. At the end of CPR time, the defibrillator prompts you to
Check for pulse. If no pulse, push Analyze.
If there is no pulse, push Analyze to restart the analysis process. If there is a pulse, proceed with your standard protocol.
I'll continue rescue breathing.
When the defibrillator is in advisory mode monitoring, it continuously monitors the ECG for a potentially shockable rhythm. If a potentially shockable rhythm is detected, the defibrillator prompts you to
Push Analyze.
You should confirm the patient is unconscious, pulseless, and not breathing spontaneously, confirm no motion is present, then press Analyze.
Analyzing now. Stand clear. Shock advised.
Motion detection is a physio-control patented feature designed to prevent analysis of ECG artifact and to prevent a rescuer from receiving a shock. If motion is detected during ECG analysis, you see and hear.
Motion detected. Stop motion.
You need to stop touching the patient, stop CPR, cardiac compression, and manual breathing. Check for other possible causes of interference if present, and stop any transport movement. Move away handheld communication devices or other equipment that may emit interfering radio frequency signals. If the motion detected message stops within 20 seconds, the defibrillator continues its rhythm analysis.
Stand clear.
If the motion detected message does not stop within 20 seconds, the defibrillator stops analyzing. You need to eliminate the motion and push the
Analyzing now.
Analyze button
Stand
again to
clear.
restart analysis of the patient's ECG rhythm.
No shock advised.
This concludes the advisory or AED mode section of this video. To use the Lifepak 12 defibrillator monitor in manual mode, it is important to know if your defibrillator is configured to power on in advisory or manual mode.
Connect electrode.
If the defibrillator powers on in advisory mode, access to manual mode may be restricted. It is important that you are familiar with and understand the power on defaults set on your particular defibrillator. Defibrillation is used by healthcare providers trained in arrhythmia recognition and treatment to treat life-threatening arrhythmias such as ventricular fibrillation. Synchronized mode is used to treat supraventricular tachycardia, atrial flutter, atrial fibrillation, and some ventricular tachycardias. Defibrillation is not indicated in the treatment of pulseless electrical activity such as idioventricular or ventricular escape rhythms and in the treatment of asystole. To defibrillate a patient using manual mode, power on the defibrillator, expose the patient's chest, and prep the skin for therapy electrode placement. Apply the electrodes in the anterior lateral position. Connect the therapy electrodes to the therapy cable. Confirm the ECG rhythm. Check that paddle's lead is selected. If not, select paddle's lead or apply ECG leads. Confirm the appropriate energy is selected or select energy per your local protocol.
Clear.
State that you are charging the
Charging.
defibrillator and press charge. The defibrillator charges, gives an alert tone when full charge is reached, and displays the message to push the shock button.
I'm clear, you're clear, everybody's
Firmly
clear.
state to clear the patient and check that the
Shock.
area is cleared. Then press shock. Reassess the patient and the ECG rhythm. If the ECG rhythm is unchanged, select the desired energy. Repeat the charge and discharge sequences according to your local protocol. To perform synchronized cardioversion, prepare the patient for the procedure according to your local protocol. Connect the patient to the ECG electrodes and cable as previously described in this video. Select the ECG lead with the greatest QRS amplitude or height. Press sync. Sense markers should appear on the R wave and the sync LED flashes with each detection. Prep the patient's skin and apply the therapy electrodes in the anterior lateral or anterior posterior position. For cardioversion of atrial arrhythmias, one of two alternatives for anterior-posterior placement is shown here. Place the apex electrode over the left precordium with the upper edge of the electrode below the nipple. Place the other electrode on the patient's back, to the right of the spine and below the scapula. Select the appropriate energy. Charge the defibrillator and proceed as previously described for manual defibrillation.
I'm clear, you're clear.
Discharge the
Clear.
defibrillator by pressing and holding the shock button until the discharge occurs. Assess the patient and the ECG rhythm after the shock. If the arrhythmia persists, select energy according to your local protocol. If your defibrillator is configured to automatically return to asynchronous mode following a shock, press sync again. Repeat the charging and discharging
I'm
sequence.
clear, you're clear. We're all clear.
You can remove an unwanted charge at any time by pressing the selector. The energy is removed internally. The charged defibrillator also disarms automatically if shock is not pressed within 60 seconds, if the electrodes or cable become detached, or if energy select is pressed. Press charge again to recharge the defibrillator. During sync cardioversion, the sense markers should appear near the middle or peak of the patient's QRS. If sense markers do not appear, are near the end of the QRS complex or on the T wave, decrease ECG size to the minimum and then increase until they are placed correctly. Alternatively, select another lead. This concludes the manual defibrillation and synchronized cardioversion section of this video. Non-invasive pacing is a means of treating symptomatic bradycardia and asystole. Conscious patients may require sedation to tolerate the pacing current. To pace a patient, power on the Lifepak 12 pacemaker, prep the skin, connect the ECG cable and electrodes, placing the electrodes well away from the therapy electrodes, and apply the therapy electrodes in the anterior lateral or anterior posterior positions. Press pacer. Confirm that the LED lights and that the sense markers appear and are properly positioned on the patient's beats. The demand pacing menu also appears. Select the desired pacing rate by pressing the rate button or rotating the selector. Increase current by pressing the current button or rotating the selector. Slowly increase the current until electrical capture is achieved. Look for a wide QRS and a broad T wave following the pace markers. Assess for mechanical capture by palpating the patient's pulse and checking blood pressure. To interrupt pacing and view the patient's intrinsic rhythm, press and hold pause. The pacer will pace at 25% of the set rate. Release pause to resume pacing. To stop pacing, reduce current to 0 or press pacer. If defibrillation becomes necessary, press energy select or charge. Pacing automatically stops. Pacing therapy stops if the pacing cable or therapy electrodes disconnect. A message and alarm tone sound. After the electrodes are reconnected, the alarm silences, and the status message indicates pacer off and current is 0. If current is not increased within 20 seconds, the alarm repeats, reminding you to increase current. Increase current to resume pacing. ECG distortion during pacing, as seen on this trace, may occur because the ECG electrodes pick up pacing current. This may be mistaken by the operator as electrical capture. ECG distortion lacks the tall, broad T wave seen with electrical capture and is not accompanied by a palpable pulse. If distortion is observed, change to another ECG lead or prep the skin and reapply the ECG electrodes away from the pacing electrodes. Always assess the patient for mechanical capture. If the monitor detects an ECG lead-off condition during pacing, the ECG trace becomes a dashed line and an alert tone sounds. Pacing therapy continues as a status message indicates, but at a fixed rate, regardless of the patient's own rate. Replacing the ECG lead restores the trace and clears the alarm. This concludes the non-invasive pacing section of this video. Here are some key items to remember. AED, or advisory mode, is to be used only on unconscious persons, not breathing, and without a pulse. It is not designed to be used on infants or children younger than 8 years old because of the high energy levels. Do not use the defibrillator in the presence of anesthetics or other flammable agents. Use care in the presence of oxygen. An electrical arc may cause a fire or explosion. Turn off or remove the oxygen source prior to shocking the patient. Do not allow standard paddles or therapy electrodes to touch each other, ECG electrodes, lead wires, dressings, or medication patches. Contact can cause arcing and patient skin burns during defibrillation and may divert energy away from the heart. Observe the patient continuously while the pacemaker is in use. Ventricular capture threshold may change over time, resulting in loss of capture. To obtain a 12-lead ECG, power on the defibrillator and insert the precordial lead attachment into the main ECG cable. Prep the skin and place the ECG electrodes as previously described, but at the following sites. First, the limb lead electrodes are typically placed on the patient's wrists and ankles. Place the right arm electrode near the wrist on the inside of the patient's right arm. Place the left arm electrode near the wrist on the inside of the left arm. Place the left leg electrode on the inner aspect of the left leg near the ankle, and place the right leg electrode near the ankle on the inner aspect of the right leg. Though they can be placed anywhere along the limbs, do not place the limb lead electrodes on the torso when acquiring a 12-lead ECG. Next, place the precordial leads 1 through 6 on the chest. Accurate placement of these leads is critically important. Practice finding the landmarks on yourself and others. The electrode placement for precordial lead 1 is in the 4th intercostal space to the right of the sternum. To locate this position, place your index finger in the notch at the top of the sternum. Move your finger down the sternum until you feel an elevation or thickening of the bone. This is the angle of Louis, where the manubrium joins the body of the sternum. Move your finger down and to the patient's right into the depression between the 2nd and 3rd ribs. This is the 2nd intercostal space. Move your finger down the right side of the sternum 2 more spaces. You have located the 4th intercostal space. Apply the V1 electrode. Move across the sternum to the 4th intercostal space on the patient's left side. Apply the V2 electrode. Precordial lead 4 is located next because it is a reference point for V3. V4 is located in the 5th intercostal space at the mid-clavicular line. Find the 5th intercostal space by palpating for the intercostal space below the V2 position. Then follow this space with your index finger laterally to intersect with the mid-clavicular line. Place the V4 electrode at this point. Place the V3 electrode directly between V2 and V4. Place the V5 electrode level with V4 at the interior axillary line. Place the V6 electrode level with V5 at the mid-axillary line. When performing 12-lead ECGs on female patients, place the electrodes for leads V3 through V6 under rather than on the breast. Once all the electrodes are applied, encourage the patient to lie still. It will take a minimum of 10 seconds for the monitor to acquire a 12-lead ECG. Press the 12-lead button. The 12-lead age menu appears. Enter the patient's age with the selector. If an age is not entered, the 12-lead automatically selects 40 and begins acquiring the 12-lead ECG. The monitor acquires, analyzes, then prints the 12-lead ECG. The Lifepak 12 defibrillator monitor is configured to print the 12-lead report in the 3-channel format. Standard 4-channel and Cabrera formats are also available. Consult the operating instructions for more detailed information about these formats. If the monitor detects a noisy signal or ECG leads off condition while acquiring the 12-lead ECG, the message noisy data, press 12 lead to accept appears. Check whether the patient is relaxed. Ask the patient to lie quietly. Check electrode contact or reposition lead wires to eliminate the signal noise. The monitor resumes acquiring the 12-lead ECG as soon as the signal clears. If you are unable to clear the noisy data message, press 12-lead a second time. This forces the monitor to acquire the data in spite of a noisy signal. Any 12-lead ECG reports acquired in this way are annotated with the message, ECG override, data quality prohibits interpretation. For more information about troubleshooting ECG noise, request a copy of the Lifepak 12 Bulletin about ECG bandwidths and ECG troubleshooting. Precordial lead electrodes and lead wires can interfere with the placement of standard paddles or therapy electrodes. Before defibrillation, remove any interfering electrodes and lead wires. This concludes the acquiring a 12-lead ECG section of this video. The non-invasive blood pressure monitor is another helpful tool that can be used to automatically measure the blood pressure of an adult or pediatric patient. To use the NIBP monitor, power on the monitor and adjust the contrast if necessary. Select the appropriate size blood pressure cuff and apply it snugly to the patient's extremity. The exact position of the cuff is not important because the cuff provided by physio does not have a bladder and inflates completely around the extremity. Connect the tubing to the cuff and connect to the NIBP tubing connector on the monitor by pushing the connector straight in until a snap is heard. Before taking the first blood pressure measurement, change the initial cuff inflation pressure if necessary. The initial cuff inflation pressure should be set to 30 millimeters of mercury higher than the patient's systolic pressure. The factory default for the initial inflation pressure is 160 millimeters of mercury. After a first reading, the NIBP monitor automatically adjusts the inflation pressure to be about 30 millimeters of mercury higher than the patient's systolic pressure. If you know the patient's blood pressure and need to adjust the inflation pressure, select the NIBP area on the screen. Select initial pressure and choose the appropriate inflation pressure. Be sure not to select an inflation pressure that is below the patient's systolic pressure. Doing so may cause the NIBP monitor to reinflate and take longer to obtain a reading. This could also be very uncomfortable for the patient. Position the patient's arm in a relaxed and supported position at about the same level as the patient's heart. Tell the patient that the cuff will inflate and cause a big squeeze around the arm and that his or her fingers may tingle. Advise the patient not to move their arm during the measurement because it could make it even more uncomfortable. Press NIBP to start a measurement. The NIBP area shows the increase in pressure as the cuff is inflating. When the inflation pressure is reached, the cuff slowly deflates and the blood pressure measurement is obtained. Be sure the patient's arm is not moving during the deflation cycle. Arm movement will interfere with the measurement and cause the NIBP monitor to reinflate and take longer to obtain a reading. This can become very uncomfortable for the patient. The blood pressure is shown here in millimeters of mercury. Blood pressure may also be configured for measurement in kilopascals. The top number is the systolic pressure, the bottom number is the diastolic pressure, and the smaller number to the left is the mean pressure. An NIBP measurement can be stopped and the cuff deflated at any time by pressing the NIBP button again or by disconnecting the cuff or tubing. Dashed lines appear in the NIBP area, indicating that the last measurement was interrupted. The monitor can be set to automatically measure blood pressure at a recurring interval, such as every 10 minutes. Automatic intervals can be pre-configured or selected during use. To set an interval while monitoring a patient, use the selector to highlight and select the NIBP area. The NIBP overlay appears. Select interval. The available intervals are displayed from 2 to 60 minutes. Highlight the interval that is desired. Select Start or press NIBP to initiate a blood pressure measurement. After the blood pressure measurement is obtained, the timer is displayed next to the systolic pressure. The timer counts down, indicating the minutes remaining until the next NIBP measurement. The Lifepak 12 NIBP monitor has built-in messages to help troubleshoot problems that may arise. NIBP check cuff indicates the tubing is not connected to the cuff or the monitor or is kinked. Reconnect the tubing and repeat the NIBP measurement. NIBP motion may occur when the NIBP monitor detects the patient is moving continuously during the deflation. Remember to advise the patient when a blood pressure measurement is going to occur and to keep the arm relaxed. For more information about troubleshooting, messages, and suggested corrective actions, consult your operating instruction manual. This concludes the non-invasive blood pressure monitoring section of this video. End-tidal CO2 monitoring is another helpful tool that can be used to continuously measure the expired CO2 in adult and pediatric patients. End-tidal CO2 monitoring is accomplished using the appropriate microstream accessories, either a nasal filter line, which is used with patients who are not intubated, or the airway adapter and filter line, which are used with patients who are intubated. The high humidity filter line is recommended for longer-term CO2 monitoring of intubated patients. In this video, we will demonstrate the use of the nasal filter line. The instructions for the airway adapter are on its packaging. To monitor end-tidal CO2, connect the nasal filter line tubing to the CO2 tubing connector. Insert the filter line connector and turn the filter line wings just until some resistance is felt. Power on the monitor and adjust contrast if necessary. The CO2 monitor senses when the filter line is connected and begins initializing immediately. This initialization warm-up includes a self-test and auto zero and may take up to 2.5 minutes. Apply the nasal end of the filter line to the patient with the prongs curving downward and secure the tubing by sliding the sleeve up toward the chin. The CO2 area on the screen displays the end-tidal CO2 measurement in millimeters of mercury, percent, or kilopascals. These units of measure must be pre-configured in the monitor. The CO2 area also displays respiratory rate in breaths per minute. To display the CO2 waveform, select channel 2 or 3. Select waveform in the channel overlay and select CO2. The continuous CO2 waveform is displayed along with a scale on the right side of the screen. For more detail about the phases of the CO2 waveform, consult the operating instructions. To change the CO2 scale, select channel 3, select scale, and then select the desired scale range. When quick-set alarms are selected, the CO2 monitor provides high and low end-tidal CO2 alarms and a high inspired CO2 alarm. An apnea alarm is also provided, independent of the quick-set alarms, and is on whenever CO2 monitoring is in use. An apnea alarm will occur when the device has not detected a valid breath for 30 seconds. The alarm message includes the time since the last detected breath. The alarm clears once a breath is detected. If an apnea alarm occurs, first check the patient and then the tubing to see if it has been dislodged or disconnected. The alarms can be temporarily silenced by pressing Alarms. When CO2 monitoring is no longer desired, disconnect the filter line from the device. This removes any CO2 alarm condition and reduces the power drain on the battery from the CO2 module. The Lifepak 12 N-Tidal CO2 monitor has built-in messages to help troubleshoot problems that may arise. CO2 filter line off indicates that the filter line is disconnected from the CO2 connection on the monitor. Reconnect the filter line to the monitor as previously described. CO2 filter line purging indicates the filter line may be clogged or twisted, or in the case of air transport, that a rapid altitude change occurred. After 30 seconds of unsuccessful purging, the message CO2 filter line blockage appears. Remove and reconnect the filter line, or replace if necessary. For more information about troubleshooting, messages, and suggested corrective actions, consult your operating instruction manual. Caution: failure to keep the CO2 tubing connector door closed when not in use may cause water or particulate contamination of the CO2 sensor. This may cause the CO2 module to not operate. This concludes the N-Tidal CO2 monitoring section of this video. The invasive pressure monitor can be used for measuring arterial, venous, intracranial, or other physiological pressures. Invasive pressure monitoring involves the conversion of fluid pressure into an electrical signal. The conversion is accomplished with a pressure transducer. The transducer is connected to a patient's indwelling pressure catheter using a special assembly of tubing, stopcocks, adapters, flush valves, and fluids, commonly known as a flush system. The transducer translates the pressure wave into an electrical signal. A well-functioning flush system is essential for obtaining undistorted waveforms and accurate information. Note that intracranial pressure monitoring does not use a flush system connected to the transducer. The Lifepak 12 monitor can display two pressure waveforms via the two invasive pressure connectors. For information about compatible pressure transducers and cables, refer to the operating instruction manual. To perform invasive pressure monitoring with the Lifepak 12 monitor, first prepare the transducer and flush system according to the instructions provided with the transducer and flush system, or according to your local protocol. Turn on the monitor and connect the invasive pressure cable to one of the invasive pressure connectors on the monitor and to the transducer. The pressure parameter area appears on the monitor screen. Use the default label P2 or change the label to match the pressure to be monitored. To change the label, select P2 parameter area. From the menu, select P2. Select a label from the list. For this video, we will use ART. To display the waveform, select channel 2 or 3 from the main screen. For the purpose of this video, we will be using only channel 3. From the channel 3 menu, select Waveform. Then select ART from the menu list. Notice that the message P2 not zeroed is displayed in the status area. To avoid offset errors, a zero reference must be established before a meaningful pressure reading can be obtained. This is done by opening the transducer stopcock to air so that atmospheric pressure becomes the reference. Select 0 from the channel 3 or parameter menu. The messages P2 zeroing and P2 zeroed appear. When zeroing is complete, the pressure values are displayed as zeros. Close the transducer stopcock. Be sure that the transducer is positioned at the patient's phlebostatic axis as a zero reference level. The patient's pressure waveform should be displayed. Pressures between -30 to +300 millimeters of mercury can be displayed, and 6 scales are available. When auto scale is selected, the monitor automatically selects the appropriate scale for the waveform based on the measured pressure. Once the waveform is on the display, confirm that the pressure waveform amplitude correlates with the digital readout. If the transducer or cable are disconnected from the monitor, the message P2 transducer not detected appears, and the parameter values and waveform are dashed. Reconnect the transducer and re-zero the transducer as described previously. To troubleshoot problems with the pressure waveform, consult the operating instruction manual and follow your clinical protocols. This concludes the invasive pressure monitoring section of this video. From the moment the patient is connected, the Lifepak 12 defibrillator monitor automatically compiles a patient record that consists of a code summary critical event record and a continuous ECG report. The code summary has three parts: a preamble, an event vital sign log, and waveform events such as initial rhythm and defibrillation. The preamble contains patient and device information. The defibrillator automatically enters a unique ID number for each patient, composed of the date and time the defibrillator is turned on. The event vital sign log documents device and operator actions related to monitoring, therapy, data transmission, and more. Vital signs are also listed for each monitored parameter. Events and vital signs are listed in chronological order. Waveform events include header information and the ECG associated with that event. Lead ECGs are also included in the code summary record. To print a code summary record, press Code Summary. For all the active parameters monitored, vital signs can be trended for up to 8 hours and printed as a trend summary. This report can be printed separately or with the code summary report. To print data stored in memory for the current patient, press the Options button and select Print. If the report, format, mode, and speed settings are correct, select Print to print the current patient report. If any of these settings are incorrect, select the setting to be changed. Select Print to print the current patient report. Patient data may be transmitted to a PC-compatible computer or to a Group 3 Class 2 or 2.0 fax machine. A continuous ECG report consists of single-lead ECG data. This data can only be viewed by the CodeStat Reviewer program. Approximately 45 minutes of ECG monitoring can be stored by the Lifepak 12 defibrillator monitor. Code summary data, 12-lead ECG reports, and the continuous ECG reports can be transmitted to a PC equipped with the CodeStat Reviewer program for data collection and post-event review. Before patient data can be transmitted, the receiving sites must be entered on your Lifepak 12 defibrillator monitor. Refer to your operating instructions, Section 9, Setting Up Transmit Sites, for further details. The Lifepak 12 defibrillator monitor must have either an internal PC card modem or an external modem in order to transmit patient data. For help in selecting which modem is correct for your application, contact your local Physio-Control sales representative. These modems may be connected to either a standard landline telephone or a cellular phone. The PC card modem installs into the PC card slot on the back of the defibrillator. Using an internal PC card modem requires installation of the modem and the modem door assembly, which allows access to the phone cable and helps prevent fluids from entering the device. Failure to install or properly seat the modem door assembly will compromise the water seal rating of the Lifepak 12 defibrillator monitor. As a result, fluid may enter the device and cause the defibrillator to lose power or function, including the ability to provide defibrillator therapy. To transmit patient data using an external modem, connect the modem cable to the system connector on the defibrillator and to the modem. To download patient data directly to a PC, connect the PC serial port cable to the system connector on the defibrillator and to the PC. If you are monitoring a patient and use a system connector, all equipment connected to the system connector must be battery-powered or electrically isolated from AC power. If in doubt, disconnect the patient from the monitor before using the system connector. For more information, contact Physio-Control Technical Support. Once you have connected the desired modem, you can transmit a patient record. To transmit data for the current patient, press the Transmit button. For a fax transmission, select Fax. To transmit to a PC, select Data. Only data transmission will be demonstrated here. Fax transmission is similar in operation. If the report, site, and prefix settings are correct, select Send to transmit. If any of these settings are incorrect, select the setting to be changed. Select Report to display the report list. Choose the desired report. Snapshot sends the snapshot report. All sends all reports on the list. Code Summary sends the critical event report. Trend Summary sends the trend summary report. Vital Signs sends the vital signs report. 12 Lead sends the selected 12 lead report. Continuous ECG sends the continuous ECG report. A check mark indicates a report already sent successfully. Select Site to choose a transmit site from the list of configured sites. Select Prefix if needed for the transmit site location. Select Send to transmit. A series of messages indicates the progress of your transmission. Transmission may be discontinued at any point in the process by selecting Cancel. To access archived patient records, press Options and select Archives. If you enter Archives mode during patient monitoring, the current patient record will be saved and the Lifepak 12 defibrillator monitor will restart in Archives mode. You will not be able to continue monitoring, all therapy will be discontinued, and alarms will be disabled. To confirm that you want to enter Archives mode, select Yes to save and close the current patient record and enter Archives mode. 5 choices will appear. Send data to transmit archived patient records to a PC. Send fax to transmit archived patient records to a fax machine. Print to print archived patient reports. Edit to edit archived patient information. And delete to delete archived patient records. To transmit or print patient data, follow the procedures as previously described and shown in this video. To edit patient information, select Edit. Select patient information to be edited. Note that only blank information fields can be edited. To delete patient records that are stored in memory, select Delete, select Patient, choose from the list of patient records. Select Delete to permanently remove the selection from the archives. To undo the delete operation, immediately select Undo. If you continue with other operations, you will not be able to undo this delete. To return to the Options Archives menu, press Home Screen. To exit the Archives mode, turn off the device. This is the end of the in-service video for the Lifepak 12 defibrillator monitor series. Be sure to refer to the operating instruction manual for more detailed information. Thank you for choosing the Lifepak 12 defibrillator monitor from Medtronic Physio-Control.